Permit me to introduce the officers that are here with me. We operate as a team in the region. He's the Regional Education Officer, acting, Mrs. Nestor Douglas. On my immediate right is the Regional Engineer, Mr. Suku. On my extreme left is the Regional Health Officer, Dr. Shifoon, and on my extreme right is the Deputy Regional Executive Officer, Mr. Gopal Singh.
2016 has been a momentous year for the Regional Health Department, along with the Regional Administration's support. During that year, we have discussed, shared, and learned about the evidences and responses needed to achieve better health for all people of Region 5 and the rest of Guyana. During 2016, some of our major achievements that we have achieved was, given the layout of the region, it is divided into two sub-regions. Sub-region 1, which is from Maikoni straight to Mahaika, and sub-region 2 from Maikoni to Ithaca. But the region only had one diabetic foot center. In 2016, we have seen the construction of a new diabetic foot center in sub-region 1 at the Maikoni Hospital, which catered for the patients coming from till far as Mahaika, who had to come to Fort Wellington. Now they can access this service at Maikoni Hospital, saving in on the transportation costs, and it's making healthcare more accessible and affordable to those persons in that sub-region. A survey of the hospital facility at Fort Wellington Hospital was also done, and they saw the need to remodel the rehabilitation building at Fort Wellington Hospital. This remodelation was necessary since we've had more of our patients from time to time as medicine has advanced. We need to cater for those persons who suffer from stroke or cater for those who need to be rehabilitated because of physical or mental disability. Some of the persons also that access care at this facility would be those persons who have hearing problem or sight problem, which was congenital or developed from birth. The two rehab building was joined and made into one building where all rehabilitation services were offered under this one facility, this one building. We have had the addition of one new audiology technician to work in this building, so we have 3 in our region now. We have developed a school screening program to try to screen children who are born with these congenital anomalies, hearing problem especially, so that we can facilitate them going to Georgetown to access, to get hearing aids so that they could get a better education and benefit from what we have to offer. Because the region has been, for years, the region has not had proper lab facility. The Regional Department of Public Health, along with the regional administration, developed, working along with Ministry of Health and the Department of Standards, we have developed a model design for the 2 labs, one at Fort Wellington and one at Maikoni Hospital. These labs are the model lab for the country. They have been standard recommended and they have been constructed to suit that form. The machines to work in these labs were purchased last year as capital approved, and they are now being installed so that they can serve the persons of this region. All of the lab are coated with antifungal, antibacterial covering, the countertops and the flooring, and every amenity that the labs offered would be that of sterile quality and that is recommended by standards. So we're excited to see what the future will hold when we put these facilities into action. Because of the plans in 2017 to open our operating theater back in the region, we have decided to construct a new central sterilization unit to cater for regional sterilization that has to be done for all the health centers and both hospitals. This sterilization unit will cater for all sterile gauze, sterile instruments, speculum, everything that has to be used within our health facilities, where we have 16 health centers and the 2 hospitals. It will cater to do all the sterilization for all of these stuff. Thinking ahead, we have also sent 2 of our nurses to be trained to work in this department so that they can facilitate the sterilization of the equipment so that they could go out to the different facilities. One of the problems that we faced in the past when we did a survey was that the sharp needles that were collected at the health centers had to be destroyed at the incinerator at the hospitals, either Maikoni or Fort Wellington, which was causing a backlog because you have to destroy the pathogenic waste at the hospital also. So with discussions with the engineer and REO, we have decided to build a Demon Fort type incinerator that's for the sharp and to destroy all infectious pathogens. And this incinerator was successfully completed at number 28 Health Center. This incinerator will work once a week to destroy, with a schedule that we have planned, the sharp waste from all the health centers, whilst the hospital now can have its Demon 4 type incinerator to destroy just hospital waste, eliminating that problem of backlogging that we had before. We have decided to attack the problem of double dipping that had existed in the regions. One of the problems why you would experience a problem with drugs is because we have one patient going to multiple health facilities and collecting drugs at all the health facility for purposes maybe hoarding, or purposes maybe they fear there will be a shortage, so they feel they need to stock up. Working along with the regional administration and Ministry of Health, we have designed a medical certificate and a booklet on how we can track these persons down. To date, we have not 100% eliminated this double dipping, but we have decreased the amount of persons that double dip a lot. Up to last week, we have held our second double dipping workshop so that all pharmacy assistants and doctors within the region can become more aware of how we can tackle this situation down. Because we are not completely eliminating, we have not completely eliminated this double dipping, what we have decided to do, we have decided to go into a full HMS system, which is a hospital management system. Last year on savings, we were able to network the entire Fort Wellington Hospital, where all departments are functioning together on one network. This networking, now just let me explain what happened. If the pharmacy weekly reports that has to be submitted, the pharmacy department doesn't need to print it out and then bring it up as a hard copy. They could just drag it from their PC and put it into my network, which goes into my office, and I can access it upstairs. I can also access the pharmacy, the records, the stores, and all the departments through that networking system. We have continued those works in 2017 for the first quarter, where we completed the full networking of the hospital, and we've installed our stores inventory software, which is part of the HMS system, which is the hospital management system that we're putting into place. This HMS system would greatly facilitate how effective the hospital functions. In a nutshell, just to give you an idea, whatever goes into the stores, it goes in through a computer-based network system through the barcode reading. We have a barcode reader that will read that, and it goes into the stores. For it to come out of the stores, the ISR, or the internal stores requisition, would be the shopping list. The store's attendant now will use that to beep the stuff out of the stores. That way now we can effectively monitor how much stocks we have in the stores and monitor what is left. The software that we installed also does forecasting. So for the future, what will happen? This software can say on an average monthly basis, Fort Wellington Hospital uses 400 garbage bags. So you will need to do that. Or the software would predict and forecast for you. So the issue of shortage in the stores, that would be eliminated. We are conducting training now of our stores attendant so that they can be fully aware how to work this system properly. The pharmacy also had some facelifting done infrastructural-wise. Additionally, we had networked the pharmacy to the entire hospital at Fort Wellington. And what the pharmacy got, we worked along with Ministry of Health and Mr. Cecil Jacks from SCMH. They're installing something called an electronic drug tool at the pharmacy. It was to be installed in February, but due to an updating of the drug tool, they decided to do it in April, so we're expecting that to be installed as soon as possible. What this will do, this drug tool will eliminate completely this issue of double dipping. Because it will have the essential drug list on it, and it works something similar to the essential to the inventory software what we have in the stores, but it deals with drugs rather than that. Now, how do we track all of the patients that we have in the region? We do not know all of the patients we have in the region, and people can still double dip. What we have designed a program where our community health workers will go out into the community and perform something we will call a health census. For this health census, they have to go from each catchment, each house, to find out how much diabetic lives here, how much asthmatics we have, are you on treatment. This will work as one way to screen our community. It also works as a way to see how much of each sickness we have, and then we can better able to treat and forecast on how much drugs we order, for who we order the drugs, and how much persons in each area will go to each health center to collect that drugs. This way now, when we have our health centers, we will combine this information with the data that we're going to collect at the hospital when we install our EMR system.
Throughout last year, 2016, in several schools, there were efforts made to treat bat infestation and other infestation in order to create a conducive environment for our school. There is also presently a continuous maintenance program of the facilities, particularly the sanitary facilities and the compound, to ensure that they are safe for use. During 2016, we saw extension work being done in 2 of our schools. And so those areas are Woodley Park Secondary and number 8 Secondary. And in those areas, we will be facilitating the technical vocational area. Right now, we are trying to ensure that every child has access to a vocational skill. And so we are ensuring that schools are equipped with the space and with the area and the laboratory to do so. During 2016, we conducted a number of training activities because we are aware that in many of our schools we are having a number of untrained teachers, and so we ensure that training sessions were held. We had our head teachers meeting. Training was also done for new teachers who were just appointed, where they were introduced to the Ministry of Education policies, circulars, records, and documents, and also their code of conduct. The Ministry of Education has also introduced what was called a new teacher induction year program, where persons who have served CPC, who studied CPC for the 2 years, will continue to serve a 1-year induction program where they will be mentored. And so we held training sessions for the head teacher, for the mentors and the mentees, to ensure that the program is properly implemented. We continue to implement our cluster workshops at the nursery and primary levels, and the subject committee meetings at the secondary level. At these meetings, we focus heavily on curriculum implementation, where you find best practices are being shared. Also, you have demonstration lessons where persons are encouraged to put their best foot forward. We participated in a number of national events, and we were very successful at many of them. We participated in Mashimani activities 2016, and our regional float came forth. We also participated in the National Science Fair, National Science and Technology Fair, where Region 5 was named the most outstanding region. We worked in the J.F. Haynes debating competition, national championships, lots of art competition, poster competition. And so we continue to encourage our children and our pupils and our students to participate to gain the much needed exposure.
As of December 31st, 2016, the RDC Region 5 would have managed to expend a total of 38.13 million, representing 99.5% of the capital monies allocated. Of our total $2.26 billion that were allocated for Region 5, Region 5 would have managed to expend a whopping 99.4% of that at the end of December 31st, 2016. In our capital sector, for the capital buildings, we would have expended $121.365 million on the construction of the new technical block at number 8 secondary school, extension of the Waterloo Nursery School, a new diabetic foot center at the Myconi Hospital, remodeling of the 2 labs at the Myconi and Fort Wellington Hospital, renovation of the RDC boardroom where we are here today, among other projects. Under the recurrent maintenance of buildings, all 72 schools, along with the 15 health centers and the 2 hospitals, as well as the residential living quarters for officers and staff, and the RDC main building and sub-office were maintained and repaired to a sum of $94.198 million. Under the capital roads and land development, the RDC in 2016 would have managed to rehabilitate, maintain and upgrade a total of 6.5 miles of road within the region. Under our capital program, $74.586 million was expended on 10 roads in areas such as Novar, Ithaca, Hope, Paradise, number 12. Our recurrent expenditure, some 22 residential streets and farm-to-market access roads were maintained and rehabilitated to a tune of $84.28 million. Our capital drainage and irrigation allocation for 2016 was $57.168 million that was warranted to the MMA for them to empower some 1,300 acres of state land for cattle rearing. Our recurrent maintenance of drainage and irrigation saw an allocation of $77 million, which was expended across the region in tackling the drainage and irrigation problems, in clearing of canals, trenches, and drainage structures. Our capital infrastructure development saw an allocation of $13.29 million being expended at December 31st for the construction of a revetment at the District Number 10 Primary Nursery School. This was done mainly to keep off flood water from the Mahaika River from entering the school compound. A parking lot was constructed within the RDC compound, and a boathouse was done at Central Myconi Wharf to facilitate the residents of Moroccobai and fishermen to store their engines, fuel, etc. at that location. Under our capital bridges, We would have constructed Greenheart timber bridges at Dundee Airy Hall, number 28, Zorgan Hoop Fairfield, to an allocation of 24.898 million. In our recurrent expenditure, 8 residential bridges along with some farm to market bridges were maintained and rehabilitated to the sum of 19.29 million. And these were done in areas such as number 2, Trafalgar, Waterloo, number 10. In our recurrent maintenance of other infrastructure, which would include the maintenance of the drainage sluices under the RDC, along with fencing of school compound, health centers, etc., the RDC would have expended a total of 50.98 million at the end of 2016. In the fiscal year 2017, RDC Region 5 was allocated a total sum of $3.6 billion for the execution of all 5 of its programs. Of this, 395.725 million represents the capital expenditure. Constructions and rehabilitations of buildings, such as the construction of the 2 new health centers, the construction of a new nursery school at Port, the rehabilitation of the Myconi wards, and the construction of a concrete drain at the Amerindian Hostel. This to a total sum of 135.825 million on the capital buildings. For our recurrent maintenance of buildings, all schools, health centers, hospitals, as well as the RDC buildings, main office, living quarters, etc., are expected to be maintained and repaired to a sum of 124.3 million. Myself and department would have been experiencing tremendous difficulties when it comes to the maintenance of school buildings. This is as a result of a lot of delinquent students that we will have at these facilities that would frequently damage electrical outlets, our sanitary facilities, toilet, face sink, and so on. So there is always a constant need to maintain and rehabilitate these facilities. Under capital roads, it is expected that 7 roads in deplorable condition and mud dams be upgraded and rehabilitated to the sum of 88 million. These would be done in Katrina's Lost, Lovely Lass, Litchfield, Waterloo, Paradise, Rosignol, and Port Myconi. We plan to rehabilitate and maintain some 21 residential streets and farm to market access roads to a tune of 132 million in areas such as the Hoop, Kingley, number 5, Hydam, Isa and Jacob, Seafield, Bath, number 8, Bushlat, etc. The MMA would be warranted a sum of $25 million under our capital drainage and irrigation program for them to do rehabilitative works to sluices at Davis, Grasshook, Port, Stratcampbell, and the rehabilitation of channels at Port Bayaboo, Cottage, and Planters Hall. Our recurrent maintenance of drainage and irrigation for 2017, the RDC was allocated a sum of 90 million. It is expected that this money be used to continue our drainage and irrigation program across the region so that we can better prepare all communities to alleviate the problem that we encountered in 2016 of flooding during the May-June heavy rainfall. Under our capital agricultural development, we were allocated a sum of $52 million. This sum is expected to be used for the construction of a tarmac at the Abari sluice area to facilitate the fishermen and the persons going to purchase fish at that location. We were expected to rehabilitate a bridge at Nowhere Never and rehabilitate as well as extend roads at Good Faith, Recess, number 8, and Bayaboo. Capital Bridges, we were awarded a sum of 19.3 million, which would be utilized for the construction and rehabilitation of bridges at Hopetown, Zeskendron, Bushlot, and Union. Our recurrent maintenance of bridges, it is expected that some 10 residential farm-to-market access bridges be maintained and repaired at number 30, number 8, Bath, number 2, etc. at a sum of 24.45 million. And finally, the region was allocated a sum of $59.245 million under our recurrent maintenance of other infrastructure. This would be utilized to maintain our sluices, our fences, our compound, and our sanitary facilities at all health centers as well as our schools.
From 2016 to 2017, the regional administration and finance program, we would have received an increase in budgetary allocation. In 2016, we had approximately 156 million. We moved to 159 million in 2017. So this of itself shows you that we are heading into a good direction. Earlier during this year, myself, the regional executive officer, and the engineer, we had a leadership seminar at the Ministry of Communities, and as such, it was discussed there our areas of focus for this year. And those areas that we would have taken into consideration, they are community participation and community engagement, institutional strengthening, and infrastructure development. So in keeping with these areas, the first phase of this year, which is from January to March, we would have started working on some of the areas. We would have had a workshop/training program with counselors and members of our Rights of the Child Committee in Region 5. One, to empower the committee of the RDC, their obligations, and also the duty as a committee to the people of Region 5. What is it exactly they have to do, and the function of this committee. Also, we would have had several training programs. As I just said, the Rights of the Child Committee had one where members from the Rights of the Child Commission came down and they conducted that training program. We had a workshop on the stores regulation, because part of our strategy also is for us to implement and also to adhere to all government financial regulations and also policies and regulations governing financial practices in the region. And as such, we would have found ourselves not fully compliant with the stores regulation, and as such, the regional administration would have decided to conduct a workshop with key personnel, the overseers, assistant overseers of the NDCs, storekeepers, persons who are responsible for procurement, and also other persons within the various sections and departments in the region. We also had a procurement training session for our contractors, for them to understand the procurement process and how they should go about filling out their pre-qualification documents and also their tender documents. At that training program, we had participation of over 50 contractors, and I was told that based on our pre-qualifications, we had over 60 contractors pre-qualifying. If I am wrong, Arya will help me out during his presentation. So from this, you can see that our results, Also, lastly, as it relates to training or institutional development, we had a tax workshop on tax measures in the 2017 budget. And the specific concentration we had was on the 2% deduction of tax from resident contractors working in Region 5. And this workshop basically was to empower and to educate our staff here at the RDC and also contractors within the region so they can have a better understanding of the budget measures of 2017.